Probably the most common question we get is about knee noise. Based on our anecdotal experience coaching tens of thousands of knees over the years, we found that progressive adherence to the ATG system, in particular with progressive full knee bend, has led to less and less knee noise over time. Still, I think it's important to do my own due diligence on the subject, so here's what I found. Study number 1, with noise around the knee from a surgeon's perspective. Quote, in most cases, the noise is physiological, and it is sufficient to explain the cause of the noise to patients and reassure them. What does that mean? The noise in the joint is actually normal in most cases. These researchers go on to explain where these normal causes of knee noise come from. First, synovial fluid bubbles. In the synovial fluid, just like any pressurized fluid, changes in pressure can create gas bubbles within the knee. When they form quickly, they can make a popping sound, just like it happens in the hand. Second is ligament noise. These can all make noise with movement. The ACL, the PCL, the LCL, and the MCL. And these are not a reason for concern with knee noise. Third, the synovium or the plica catching. These are encasements for the synovial fluid of the knee joint. Both of these are also not a reason for concern. Quote, reassurance, prevention of arthrofibrosis, and promotion of rehabilitation are sufficient to manage these conditions. So that sentence just gave us the formula. Step 1, reassurance. How do we reassure? That's exactly what this video is meant to do. If you have painless knee noise, have no fear, you are okay. Step 2, prevent arthrofibrosis. Arthro equals joint. Fibrosis means a thickening of the tissue. The knee joint can thicken and tighten into flexion, which makes it harder to extend. If your hamstrings are tight, you're more likely to get a knee joint that's prone to flexion. If your calves are tight, you're more likely to get a knee joint that's prone to flexion. And if your groin is tight, you're more likely to get a knee joint that's prone to flexion. The knee joint can also thicken and tighten into extension. Reasons for that: a tight joint capsule, tight quads, or tight ankles. Step 3, promotion of rehabilitation. For rehabilitation, these surgeons specifically mentioned hip flexor, IT band, calf muscle, inner thigh, and VMO. So there's your routine for muffling the knee when the noise is pain-free. Okay, so what about painful knee noise? Pathological noise comes with pain or swelling and includes degenerative changes, pathological plica, patellofemoral instability. Number 1, degenerative changes. This refers to when this bone and this bone begin the process of losing their cartilage, leading to bone spurs and cysts at the margin of the joint. This happens to an imbalance in tolerance, either too much or too little loading. Number 2, pathological plica. This is when the synovial fluid capsule becomes irritated or damaged, again, from either too much or too little forces. Our bodies act according to the SAID principle, specific adaptation to impose demand. If a joint isn't getting stimulated to have purpose, the body will decrease resources to that joint. Number 3, patellofemoral instability. Literally, the word means that the kneecap is not stable. For all of these issues, per these surgeons' professional judgment based on the evidence, quote, the surgical method should be reserved until conservative treatment has failed and the chronic recurrent nature of the disease has caused significant functional improvement. Meaning, until you have tried your darnest to pursue cartilage, joint capsule, and kneecap ability, surgery should not be an option unless the situation has become chronic and has stopped you from functioning during your life. One more study. Observational research from the OA Initiative found that in a 4-year study of 576 people, knee noise does not predict arthritis. So, in conclusion, if your knees do this, target pain-free ability to muffle the sound. And if your knees do this, still try to target pain-free ability to muffle the sounds with everything you got for as long as you can before deciding to go under the knife.